already that starting this from scratch would be a huge mistake. Congressman, welcome to the show. I'm sure
Thank you, fair and balanced.
Okay, I'm sure you had a chance to hear some of that. You know, my whole thing, and I said it to Congressman McCarter, is, you know, it started out on a campaign trail that the whole process would be out in the open. Then, of course, it wasn't. And now it seems like, you know, okay, let's have this one-time shootout on national TV to find out who the victors are. I mean, wouldn't it be stupid for the Republicans to go for something like that?
Well, after they appeared with President Obama at their caucus, and President Obama did the best impression politically of Bill Russell deflecting shots against a Pee-wee team that I've ever seen, they might be a little bit scared to go again. I wouldn't want to go up in the center against Bill Russell.
All right, now,
President Obama was brilliant.
Okay, well, that's a matter of opinion. But having said that, the Democrats really boxed themselves in. I mean, let's face it. If the Democrats weren't so arrogant about keeping Massachusetts, you guys probably would have cobbled together a bill and had it through already. So let's talk about the sticking points that had Democrats from being able to accomplish this bill.
Well, let me say this. I think that there's been more of this bill on television and debated and on C-SPAN and committee meetings, and there was really a weak ad nauseum of the Senate, which I think is what caused the Massachusetts change. What the Senate did in going on so long and in such laborious debate and giving Nebraska a deal that revolted just about everybody is what really swept Scott Brown into office, besides the fact that Massachusetts already had in place something like the Senate plan. The fact is, Americans don't want pre-existing conditions to be a limitation on people getting insurance. The fact is, if we don't deal with health care in a responsible way, it's going to eat up more and more of our budget, cause higher and higher deficits, and cost us to lose jobs. And one of the main things that the Democrats are going to go forward on in the Congress is to remove the antitrust exemption that insurance companies have enjoyed for years under McCarran-Ferguson. And that exemption really cost the American public a lot of money, and we'll have to see if Republicans, and I think they will, join us in a bipartisan effort to give Americans a fair shake and not give the insurance industry this antitrust exemption that otherwise is basically something that baseball and football owners have. So we'd like to have some kind of a bipartisan effort, and I think that the president's offer to meet is a grand effort, and he's been reaching out. The Republicans haven't reached back. You know, on trying to take care of Social Security, 5 Republicans who supported a commission wouldn't vote for it when the president put it forward. It was Republican votes that stopped us from getting a commission to take care of the cost increases in Social Security and entitlement programs. And that's what they were supposed to be
Congressman
for.
Cohen, let's talk, really, about Main Street. Now, some of the things you've just mentioned, I don't know that that's what was resonating among the voters. I don't know that the average person out there is too concerned about the antitrust aspect of this. On your website, when you talk about health care, 2 words that I saw that stood out. You talked about affordability and accessibility. Now, a lot of people look at this. If you put 30 million people into the system, a lot of people say the cost is going to go up and there's going to be dilution of health care, and that's what they're afraid of.
Well, I don't think it's going to happen, number one, because what we've had with the free market, Congressman McCarter and I agree we need to protect our 4-legged friends, and we're together on that. But when it comes to our 2-legged constituents, health care has increased by double over the last 10 years in America, and it hadn't happened in any other country on the face of the globe. We go up to 8 to 10% each year in health care costs with the free market system we've had, and yet 1 to 2% increases in other places. So there needs to be some type of other type of effort. And the 30 million people without insurance, they're getting health care, but we're paying for it on a tax of $1,000 a person that we don't recognize when they go to emergency rooms for the most expensive care possible. And in my city of Memphis, our emergency center, the trauma room, the med is in danger of closing.
Okay, we have less than a minute, but I want to ask quickly, is there anything that the GOP has suggested so far that you think the Democrats will go for in terms of health care reform?
Well, I think there's some interest in tort reform. In the House bill, we had some tort reform in it. Our state of Tennessee has reduced tort reform cases by tort cases, medical liability malpractice cases, by about 2/3 by having a board that would first have to give a approval to having a case to go forward in court. And I think something like that could be successful, and some middle ground could be arrived at. And some type of interstate system, I think, could come forward if we had certain limited standards that we maintain in each state and make sure they just didn't go to some poor program.
All right, well, you know what? The GOP said that the election of Scott Brown was their version of Will Chamberlain, and maybe they'll meet your Bill Russell real soon. Thanks a lot, bud, Congressman.
Scott Brown was from Massachusetts. He knows Bill Russell.
All righty.
Nice to be with you.
You too. Well, blame it on the snow, Senate Democrats.